Vaccine Brings Us Closer. So I'm going to go through the next slide, which is our agenda today, and then get right into it with our lead keynote speaker. Our lead keynote speaker is Anuradha Gupta, the Deputy Chief Executive Officer of GAVI, the Vaccine Alliance. She will be addressing vaccine challenges and ways to achieve equity and access. I'm pleased that we'll next go to a public health panel, Advancing Global Vaccine Literacy, with Heidi Larson, Nancy Lee, and Larry Gostin, who I'll introduce later. An employer network panel with the 3 largest global networks, along with ourselves at U.S. Council for International Business. That's Roberto Santos of the International Organization of Employers, Karami-Ruiz of the Business Industry Advisory Council to the OECD, and Andrew Wilson of the International Chamber of Commerce. We then will have a private sector panel called Business Steps Up with Julia Spencer of Merck, or Merck Sharp and Dome globally, Meredith Flynn-Ripley of Salesforce, and Dr. Vicky Weldon of ExxonMobil. And then I'm pleased that we'll offer the final remarks to Peter Robertson, who's president and CEO of the USCIB and USCIB Foundation. So without further ado, I'm going to do a quick introduction of Anuradha Gupta, who's the Deputy Chief Executive Officer of GAVI, and go right into the keynote presentation. She had joined and led efforts to put equity and gender at the center of GAVI's programmatic planning and to tailor and to support countries with GAVI's strategy since 2015. Anuradha has also driven efforts to create a new model of country-level alliance support through the establishment of the Partners Engagement Framework. Prior to GAVI, she has been Mission Director of the National Health Mission of India, where she ran the largest and most complex public health program in the world. Given what's happened in India now, and our hearts go out to the thousands and now over 1 million people who have passed from COVID. We know we need to do something major, and we're happy that we have this great presentation today. There will be a short time for question, but as Jen Falcon mentioned earlier, we'll be monitoring the chat and also having an opportunity for some interaction directly following this keynote speech. So over to you, Anuradha.
So thanks, Scott, for that very generous introduction. Hi, everyone. So glad to be a part of this important event. The current COVID pandemic is a reminder not only of the power of vaccines, but also the power of partnerships and solidarity. I really believe that in order to end the acute phase of this pandemic, it will be crucial that all of us join hands and take collective action to ensure equity so that we leave no one behind with immunization, including COVID-19 vaccines. As we have heard many times before, no one is safe until everyone is safe. And we are seeing this play out with the fast spread of new variants and devastating 3rd and 4th waves of the virus ravaging many countries, including my home country, India, as you're all aware. That is why the work of networks and alliances like GAVI are so vital. GAVI's mission of making sure that everyone is reached with life-saving vaccines is now more relevant than ever. I'm sure many of you are aware that GAVI was set up at the turn of the millennium to respond to an acute market failure. Powerful new vaccines were becoming available around that time, but lower income countries simply could not afford them. In response, a group of founding partners brought to life an elegant solution to encourage manufacturers to lower vaccine prices for the poorest countries in return for long-term, high volume and predictable demand from those countries that actually together accounted for 60% of the global birth cohort. Today, GAVI is the single largest purchaser of childhood vaccines, enabling us to expand the pool of vaccine manufacturers, improve supply security, incentivize product innovations, and secure highly affordable vaccine prices. For example, we pay about $25 for a set of vaccines that cost more than $1,000 in advanced economies. But vaccines do not deliver themselves. This needs strong health systems. That is why we also support countries to improve their supply chains, data systems, capacitate their health workforce, spur community demand, which is actually the topic of today's discussion. And in the process, we encourage path-breaking innovations in partnership with private sector. GAVI's unique public-private partnership model has had incredible success. In less than 2 decades since GAVI was set up in 2000, 70% fewer children are dying of vaccine-preventable diseases, and 14 million lives have been saved. Today, coverage of some of the key GAVI-funded vaccines is higher in GAVI countries than in the rest of the world. And immunization is today the most equitable health intervention, even in very resource-constrained settings where we actually support countries. And that means that immunization is able to provide protection to the most marginalized, but also prevent medical impoverishment. But we know that our work is far from done. Even before the pandemic, 20 million children born every year remained deprived of the basic course of vaccines, with 2/3 not receiving even a single vaccine shot. These are zero-dose children, and they embody communities that face compounded vulnerability, poverty, gender barriers, stigmatization, low access to education, nutrition, sanitation, water. These zero-dose children, surprisingly, or probably not surprisingly, represent only 13% of the population, yet they account for nearly half of all children dying from diseases that could so easily be prevented with the use of vaccines. Therefore, GAVI's new ambitious strategy has equity as its guiding principle, and these zero-dose children are our North Star guiding all aspects of our work. When the COVID pandemic struck last year, it was natural for GAVI to build off its long track record in demand aggregation, pooled procurement, and innovative finance to set ourselves a new goal of rapid and equitable access to COVID-19 vaccines. This vision driving this global mechanism that you are also familiar with, COVAX, is to bring the world together in making sure that all countries, regardless of their income or paying capacity, receive enough vaccines within this year to protect vulnerable and high-risk populations. This, we believe, is essential to avoid a repeat of what we saw with H1N1 in 2009, where a few wealthy countries tied up global vaccine supply, leaving the vast majority without access. COVAX represents a unique multilateral collaboration between GAVI, its core alliance partners, WHO and UNICEF, and CEPI, you are aware of, Coalition for Epidemic Preparedness Innovations. We always knew that achieving COVAX's ambitious goals was going to be a long and hard marathon with multiple obstacles to overcome, including challenges related to supply and demand, funding and logistics. Despite unprecedented global solidarity that characterizes COVAX, unfortunately, we have seen challenges with global supply chain, export bans, manufacturing delays, and competing priorities. Countries with largest number of COVID-19 cases and deaths are under unprecedented strain to vaccinate their own populations, both at pace and at scale. Besides the challenge of health systems getting overwhelmed, as we presently see in India, continued transmission means risk of mutations and variants, some of which could defy the current vaccines. As a result, supplies to several countries would be slower than anticipated. Though we are celebrating the fact that COVAX has been able to commence supplies to more than 100 countries in virtually the same time frame as some of the most advanced economies. However, it is also evident that besides supply issues, there are demand-related challenges that need to be addressed effectively. We are seeing vaccine hesitancy even on the part of health workers and professionals, and therefore low turnout in places that are offering COVID vaccination. Low demand among health professionals in India, for example, at initial stages slowed down vaccination, pushed up wastage of highly scarce vaccines, and led to flare-up of the disease. But as we discuss COVID vaccines, let us not forget that the collateral damage of COVID-19 is colossal. Health systems are overwhelmed, essential health services are disrupted, and deaths from other diseases are increasing. The knock-on impact on childhood vaccination in lower income countries and vulnerable population has been devastating. At the same time, rumors and misinformation around health and immunization have spread at unprecedented speed and intensity across all regions and in all languages. This COVID-19 infodemic came at a time when hesitancy about long-established vaccines was already a real and present danger. Although vaccination remains a well-accepted social norm worldwide, a combination of factors, including misinformation, decreased trust in institutions, including government, science, and industry, and weaknesses within health systems have diminished trust and confidence among some populations. That's why in recent years, GAVI has been stepping up its work on demand. Only if we understand how people think, feel, and act in relation to vaccination can we develop effective strategies that will ensure high community uptake driven by the timely collection, analysis, and use of data. We are working to support national demand generation efforts that increasingly go beyond printing posters and T-shirts to a much more systematic use of behavioral science. We are learning a great deal from the integrated marketing approaches of the private sector. For example, in India, GAVI and Government of India worked with Lifebuoy, a Unilever soap brand, to co-promote immunization and hand washing to young parents with a specific focus on reaching zero-dose children and missed communities. After 300 days, the proportion of zero-dose children in areas in which the program operated dropped from 25% to under 1%. We are now expanding that same concept to design a similar approach in Indonesia. Gender, I personally am very passionate about, and we recognize is an integral part of our equity agenda, particularly given the disproportionate gendered impacts of the pandemic. In India, we have been working with SEVA, the Self-Employed Women's Association, using a women-led community engagement model. By going door to door, using social media and group meetings in the past few months, SEVA workers have reached more than 150,000 households for infant vaccination, while also identifying high-risk groups in the community for COVID-19 vaccines. SEVA also worked with DMAGI, a for-profit social enterprise, to design a purpose-built application for training, communicating, gathering data, and tracking vaccination uptake, and also really understanding what are the barriers that are holding back families from bringing their children forward for routine immunization. It is a great example of what can be achieved by combining private sector ingenuity with community empowerment, harnessing the power of women as change agents and not simply beneficiaries. The pandemic is providing us with a giant teachable moment for immunization. We are learning about the value of vaccines as never before. It also presents us with an opportunity to build a true social movement for vaccination. But it is clear that no organization or government can do this on their own. GAVI's phenomenal achievements to date have been made possible by GAVI's unique alliance model, which brings together the skills of a variety of partners, combining the technical expertise of the development community with the business know-how of the private sector, but also, most importantly, very strong country leadership and ownership of immunization as a development priority. If we are to end this acute phase of the pandemic and truly put mixed communities and vulnerable populations at the heart of our response, the alliances and networks will be critical. I thank you for your attention. Back to you, Scott.
Oh, thank you so much. And I want to thank you for one of the most inspiring speeches, but also challenging speeches that I think really set the stage for what we're about today and why we've put this Convince initiative and other activities together. There have been some points here that I'd just like to also remind that we are recording this event and we are not having Chatham House rules. We think all of this should be on the record and really look forward to actually continuing along the areas that you've mentioned, Anuradha. Most importantly, to not forget that childhood diseases that are still devastating, that are vaccine preventable, to not forget the challenges that you mentioned pre-COVID, that vaccine hesitancy that work that Heidi and others are doing was also recognized and begun to be addressed by GAVI. And then even more importantly, the vaccine hesitancy that you're seeing with healthcare professionals and others in different parts of the world to also talk about later. So I don't see any questions directly in the chat, and given where we are with the timing in the next panel, I'd like to move along, but I can't thank you enough for the great work that's being done at GAVI, also for the synergies that you were suggesting of not doing this alone and being part of this event has really entered a great understanding for us to kick off the day. So I have 2 slides before I introduce the next panel, and the next panel also will have a quick question, so stay tuned. This is meant to be interactive. We created this global coalition last year, and Heidi, Larson, Nancy Lee, and myself began this with Wilton Park, London School of Hygiene and Tropical Medicine's Vaccine Confidence Project, and the CUNY School of Public Health to convene a number of meetings. And last July, UN High-Level Political Forum, we had a call to action, and at that point launched Convince, which stands for the Coalition for COVID New Vaccine Information, Communication, and Engagement. And with that, we put a mission to provide a forum and clearinghouse for multi-stakeholder efforts to manage this complex, nuanced, and immense public health challenge. We have a vision for the world. I think that we just heard from GAVI, where society accepts and trusts the importance of vaccines to keep people healthy and the global economy functioning. Since we began in July, we have 4 work streams: a healthcare workforce with Sabin Institute and Ariandi Labs and others engaged, media and technologies, including BBC Media Action, Translators Without Borders, and others, community engagement, and then the private sector. And the private sector is led by Business Partners to Convince, who's convened this meeting today as we put this forward with the U.S. Council for International Business. And let me just say on the left, if I don't mind, I'm sorry, the part that's important here is the centerpiece, the vaccine literacy and acceptance. While we're working on giving people information, at the end of the day, it's vaccine literacy at all levels of society, from the individual who gets the vaccine to the policymaker who's choosing to vaccinate their workforce or to create the rules and conditions necessary for equitable access and affordability. The next slide shows where we are with Convince. And we'll be going a little bit more into that in the next session. We began with Convince, again, with the institutions that are in the far right, and then Business Partners to Convince with the U.S. Council is based both in New York with also Washington, D.C. There's a group up in Canada that has formed that's linked with us, Convince USA at the CUNY School of Public Health, and Nancy Lee will talk about the 2 events recently convened with Convince Africa and Convince Asia Pacific with Wilton Park. And we're building efforts with Heidi and others with Convince Europe. So as I introduce the next session, I think we're going to have a polling question. And this is just an open-ended question, and you can answer this very quickly, and we'll give the results before this panel. What's the most challenging issue facing COVID-19 vaccination? Is it vaccine hesitancy, vaccine access, vaccine distribution, or vaccine disinformation? And we suggest that you click on a box, and we'll give you those numbers in a moment. So while we're doing that, let me just, we'll go to the next slide of who is speaking at this next panel. And I'm quite enamored and I'm honored to be amongst some of the greatest colleagues I've had in my life with experiences that really add up to probably over a century of work with Heidi Larson, who's the director of the Vaccine Confidence Project, who's co-founder of Convince. Many of you know Heidi as an anthropologist. She's a professor of anthropology, risk and decision science at the Department of Infectious Disease and Epidemiology at the London School of Hygiene and Tropical Medicine. She's also on the faculty at the University of Washington and is a Global Health Security Fellow at Chatham House Center. She's headed many different efforts, the global immunization communication effort with UNICEF. She's chaired GAVI's advocacy task force. She's served on the WHO SAGE working group on vaccine hesitancy, and the London School Center Vaccine Confidence Project is a WHO Center of Excellence. She's been a co-founder of Convince, and over the last year, she wrote a great book called Stuck on Vaccine Rumors, which is proudly put on my bookshelf behind me. After Heidi speaks, or after the original discussion, we'll have Nancy Lee, who's joining. She's the program director of global health at Wilton Park. She also helped co-found Convince. And before joining Wilton Park, Nancy was the global policy lead for the Wellcome Trust, and she jointly managed the global health policy team. And it's there where she established Wellcome's work in vaccine and drug-resistant infection, as well as the Coalition for Epidemic Preparedness Innovations. Larry Gostin is probably one of the global experts, or the global expert on national and global health law. He's director of the O'Neill Institute for National and Global Health Law and the founding O'Neill Chair in Global Health Law. He's also the director of the WHO's Collaborating Center on National and Global Health Law at Georgetown. I'm honored to be on the National Academy's Board on Global Health with Larry. And I could go on, and I know I'm going to ask each of our speakers to also embellish not only with their wisdom, but as they like with the work that they've done that I didn't capture in their bio. So before we go right to the panel with my first question to Heidi, I think we have the results. And Jen Falcon, would you like to say anything about these?
Certainly. We have 56% of responders saying vaccine hesitancy is the most challenging issue, then followed by access, disinformation, and distribution, but certainly hesitancy out of this particular group of attendees is around hesitancy.
Great. So as you can see, is in the scientific poll of Zoom, it adds up to over 100%. So something must have happened if people answering more than one, but clearly we have challenges. And with that, I'm going to turn over to the panel and ask Heidi the first question, actually, which is on those really four areas. What is the present status of vaccine confidence, hesitancy, and distribution as you see it?
Well, I think right now it's interesting. I think we have over 100% because it does give us the option for multiple choices. And I hope people picked more than one dimension, because I think it is multi-cause where we're at right now, these different factors. It's really the interplay of these different factors, because access affects your confidence in the system, your willingness and distribution, and also it is a constantly changing landscape. I wrote an editorial for Science a couple of weeks ago that was titled "The Volatility of Vaccine Confidence," and I think we are in one of the most challenging times when it comes to communications, for sure. But all across the board, in all those domains, it's challenging because we have a fire burning and we're trying to create new tools, new ways, while putting out the fire, as it were. I think the biggest disappointment has been the leadership. National leadership has not been as cooperative necessarily as it could be. I think that landscape is changing as we get more supply. But I think scientifically it's been an incredible collaborative work. It's been remarkable how quickly, I think as a scientific community, we have failed, frankly, in terms of not talking about and why this is all moving so fast, and really the wonders of CEPI. We had CEPI, the Coalition of Epidemic Preparedness. That's because of Ebola. There was no fund for emergency funding for research in outbreak settings before we had Ebola that led to CEPIs being founded. So there was funds up front to jump in, to get started. There was a sharing of the characterization of the virus. We had a number of new technologies. We didn't talk about why these things were moving so fast in the same way we could have, working in parallel process instead of linear. So I think that was a lesson, but I think right now we're in baby steps when it comes to vaccinating the world. If 2020 was the year of trying to get it under control in the absence of vaccines and any approved treatments, it was really the medieval approaches of social distancing, masking, things that we've seen in plagues over the history. But now this is different, but it's happening at different ways in different places. So I think that one of the issues that's going on in the US speaks to the first survey of the multiple questions we had. There's been tremendous efforts at local communities. For instance, in the Black community, the local effort, the Black Coalition Against COVID, has done remarkable things to increase the willingness and acceptance and engagement of Black communities. But some of them are not getting the vaccines, not because of their confidence, that's up, but there's no access in some settings. So we don't want to get into that situation in different countries. So I think it's about choreographing right now, and it's about mapping and keeping our lens ahead. We've been very much in the moment, and I think we need to not forget to stop and look ahead, to anticipate where we're going, to put ourselves on this journey moving forward. And I'm absolutely thrilled that Anuradha could be here today to open this up and kick it off and put it all in the current situation in context, and all my colleagues and friends here. And Larry and I had done a article on vaccine mandates, which is another aspect, the whole passport mandate questions that are circulating and anxieties, managing the risks. So I'm thrilled to be here today, and thank you, everyone. I think the business community has an absolutely huge role to play here, because as Anuradha said, no one group can do this alone. Thanks.
Well, thank you, Heidi, and hopefully we'll have a chance that you and Nancy and Larry can still fire off each other. You laid out the challenges just phenomenally. And let me turn it over to Nancy and say that Nancy is part of Wilton Park, which if I want to make sure she's going to speak on her own behalf, but I believe part of the UK Foreign Commonwealth Development Office, which is the arm of Wilton Park, and she has been really terrific in bringing a variety of groups together. I think over 100 people have contributed in the Wilton Park dialogues, at least on this issue alone, notwithstanding all the other work with Nancy. So over to you, Nancy, on your feeling on the confidence, hesitancy, and the national and global challenges that Heidi laid out.
Great, thank you very much, Scott, and thank you to Jen and the organisers today. So it's fantastic to see that from, I think, the meeting in June last year, when we were setting up this initiative, we now have business partners convinced, and you are convening this significant group of private sector members and others to this conversation, because as Anuradha and Heidi have both said, this is going to take a whole of society approach, and everyone has a significant role to play. So not that much to add to what Heidi has already said in terms of setting out the challenges, but maybe just to focus in on the complexities around the access, delivery pieces, and the knock-on impact of distribution, access on hesitancy and confidence. So you know, we've seen already what the impact has on the safety concerns around the AstraZeneca and the J&J vaccines in our own local constituencies. So talking from the UK perspective, even the confidence in the AZ vaccine having gone down, but then the knock-on impact that has in other countries that are also then facing the double burden of access as well. So as Scott had mentioned, back in March, we had hosted a meeting in Africa, and that was very much focused on the access challenges they were having. We're seeing the extremes now in Africa around both access and the impact of safety on confidence. So in countries, I'm just going to give some specific examples of Ghana and Rwanda, where they've administered nearly all of the shots that they received through COVAX. So hopefully you all know that COVAX is the international initiative that has been established to fund countries who aren't able to otherwise pay for their own vaccines. And some of those, so Ghana and Rwanda have rolled out all of the shots they received from COVAX, but are then concerned about where their second shots might come from, and whether they'll get those in time. There have been reports then, given the tragic situation that we're seeing in India and the ban they have had on exports, that their export of vaccines has dropped from 77% to about 7%. And that impacts around 90 million vaccine doses that we earmarked for COVAX, and of course in the countries who have been receiving vaccines from COVAX. Then looking at the safety concerns. So again, what the impact of the delay has been on rollouts due to the safety concerns. We see then in countries across Africa where they have to be reallocating their vaccines because they haven't been taken up. So in the DRC, 75% of vaccines that have been delivered have been reallocated because they are close to their expiry date. So we're seeing a complex array of issues coming into play here. I think there was a really interesting survey because I think in different contexts, all of these things are interconnected, but in some countries, in certain, right down to the community level, hesitancy or confidence may be an issue, access may be an issue, but they are all interrelated. So remembering that we need to address them in an interrelated fashion. I think I'll stop there. Thanks, Scott.
Great. Well, thank you, Nancy, and the great input that you have from the ground, and the dialogue with Tedros and African CDC and others was quite enlightening for us from the business community, and even hearing the target of 60% by the end of 2022 of vaccination in Africa is going to be something we all have to work on, notwithstanding the challenges you've mentioned already with access and distribution. Our next speaker, Larry Gostin, is both articulate from around the world. I'm just thinking back to when I first saw him on the screen. I was in Belgium getting my family back in March 10th, and there was Larry on CNN International telling the world what we could do at that point from his perspective. And we thank you now, well over a year later. You've given lots of thought. Heidi mentioned the article that you've done with Heidi and others on mandates and the legal challenges. But what is your take really on the vulnerability of the different sectors in society, and the question that we had on hesitancy being top of mind of both the people on this survey and surveys really around the world right now?
Yeah, well, thank you, Scott. And it's a real privilege to be with you, and particularly to follow Heidi and Nancy, who are just two people I admire and have done so much. I think we really are seeing two different worlds. We're seeing the United States, the UK, European Union's a little bit further behind, but it's still there. That are kind of well on track to be climbing out of this pandemic through vaccinations. We're likely to see a bounce back of their economies, some return to normal by the end of this year, and they're able to be dealing with really privilege or luxury issues like vaccine passports or digital health passes, as we've said in a JAMA article. But that's not really where the pandemic is, and that's not where, as Heidi, I thought so thoughtfully said, where the pandemic is heading. It's really, I think of India with the crisis going on there as really the leading indicator of what we're going to see in the future, and that we may very well see a number of raging fires around the world. You know, that's a problem for public health. It's a humanitarian problem. It's a problem of moral conscience, and I do think that equity is got to be front and center for anything that we're considering. I also think that the rapidly circulating viruses in around the world now, and we're starting to see peaks, and I think we're going to continue to see them as in other regions beyond India. That it's going to be a risk for everyone, because as we know, the more circulating virus, the more likely we're going to have mutations and variants. The variants have already been demonstrated to be much more infectious, and some of them have been more pathogenic, and some of them have had some ability to reduce the effectiveness of vaccines. We haven't seen an escape variant yet, which completely escapes our current vaccine technology, but that's certainly possible in the future, even though I do think that we've got enormous ingenuity in being able to adapt our vaccines to the new variants, particularly in the messenger RNA vaccines. And so, you know, what I see is a world that's still in a great deal of trouble. And it may be even in more trouble because, you know, with high income countries experiencing a new kind of complacency and so inward looking, that the equity gap is strong. You know, we've seen a little bit of an uptick in sharing of oxygen and other medical supplies, and even some vaccines in relation to India, but it's very mild and not at all to scale about what we need. So I'm looking for something really big and bold. I mean, I think, you know, all the panelists were, you know, really right. I mean, Heidi mentioned CEPI's just been remarkable. GAVI's been, you know, incredible, and even outside the vaccine world, you know, the Global Fund has been something. So we need something really big, a kind of PEPFAR kind of program, something big and bold to really ramp up our ability to surge our vaccine and medical supplies around the world in a more equitable basis. To me, COVAX is crucial. It's, you know, I think the most important innovation we've seen internationally with this pandemic. I would like to see it become a permanent facility, and I would also like to see it supported. Right now, we've got a dynamic where the European Union, UK, US, Canada, and other places are essentially hoarding vaccines, making a little bit of a gesture. India, which was going to be a vaccinator for the world, as Heidi and Nancy said, is really now having to focus inwardly, and we're losing a lot of their exports, you know, from Serum Institute and others, which I think is a, you know, crucial blow, at least in the short term. And so it would be great to see countries, not just the US, UK, EU, and others, to support COVAX, but in meaningful and important ways, but also to have a less transactional approach from Russia and China, so that we really are working in a strongly and vibrant multinational way. And then ultimately, we're going to face really hard decisions where we do need the business community's cooperation about issues like intellectual property and technology transfer. Because I've often said, if you give a dose of the vaccine, you save a life. But if you enable another country to manufacture its own vaccines, you save a country and ultimately the world. So I think we've got enormous challenges ahead of us. It's really great, Scott, Heidi, Nancy, and others, that you're leading in this. But we've got a hard slog ahead.
Well, yes, there's a great challenge, big and bold, the world in trouble. I mean, if I could throw it back to Heidi and Nancy and how they might think Convince can make a difference in this space. And then, back to you, Larry, on the next way of engagement based upon their remarks. And then we're going to have to close this panel. But let me just remind participants, you could put some questions or chat still in that function. But over to you, Heidi and Nancy, on the Convince opportunity.
Well, I think our challenges are big, but I like the big and bold framing of it. I do think one of the gaps that I see, because I think we have to be realistic with what Convince can do, I see a gap between what's out there in terms of our area of informing, educating, engagement, and getting people to have a better vaccine literacy, as it were, or fluency, as I like to call it. But I see a gap between the information that's out there and the resources that are out there and the public. There's so much out there, and I think Convince has a crucial role that should play, and that's do the listening. And that's part of where the Vaccine Confidence Project comes in with our extensive listening networks. We know what people are asking, and help others find the resources, the answers to those questions, and not question by question, but what's behind it? What can we link that with? Because there is an abyss between there's a lot of good stuff out there in the communication space, but it's out there. A lot of it's out there on its own and not connected with communities. And so I think that translational space will be super important, not just for the public. And when I say the public, I also mean policymakers. I get a lot of calls from policymakers and heads of programs but particularly in the policy space, help, where do I start? And help give me a brief on what this all means.
Thanks, Heidi. Thanks, Scott, and thank you, Lawrence, for that setting out that challenge. So I think Convince can help in probably three things around 3 C's. So 4 C's: convening, which we're doing, connecting and catalyzing. So that's very much what Heidi has referred to in terms of taking the knowledge that we have, both from our research networks and others, and then making that available to policymakers and those who are working on the ground in real time, and communicating. So engaging both locally and globally. So this is very much a grassroots as much as it is a global effort. So I think also to Heidi's point, where we can link those who have expertise to offer, be that in the tech space, in the private sector. We appreciate that, the private sector have been really good at innovation, at kind of accelerating processes. So, where can we learn from that? Where can we take some of those innovations and apply them across the piece, both to be able to distribute vaccines, but also in the communicating as well. So in the listening on the ground to the then, kind of engaging back. So across all of those aspects, how can Convince help to be that matchmaker, so to speak, of where expertise might be needed and where it's available, or potentially where it's available and people don't know how to apply it to the challenge we have at hand, which we can all contribute to.
Thanks, Nancy. I'm going to give the last word on this panel to Larry. He's also been gracious and be on the steering committee of business partners to convince, so has some line of sight of the potential. So over to you, Larry.
Scott, were you wanting me to address the role of convince here?
Or what sectors can we engage that way, whether they're from the vulnerability side or the ones that really want to be part of this journey?
You know, I think as Heidi said, you know, we have to really engage all sectors. You know, certainly employers, businesses can and must play, you know, a significant role, as they have with many epidemics and outbreaks in the past. So I think, you know, welcoming business partnerships is really crucial. Obviously, we also want to work from the bottom up. I think it's extraordinarily important. If we want to gain the trust of the community, we need to do that at the community level with civic leaders, religious leaders, community leaders, healthcare workers, doctors, nurses. These are really crucial influencers at the local level, as you've often said really eloquently, Scott, and I agree with that. And of course, you know, one of the big drivers of misinformation is social media and the media in generally. And that's become really difficult, particularly, you know, as we want to encourage freedom of expression. At the same time, it's become really pernicious, and how we get ourselves out of that bind of this continual misinformation and disinformation flow that just circulates and amplifies is going to be really hard. It's going to, you know, it's going to take partly self-regulation, partly government. And I don't think anybody really knows the answers, but so we do have really significant challenges all around. I would just emphasize the importance of engaging with communities themselves. You know, Heidi's done this for a long time with Ebola and things in West Africa. We know that, you know, solutions lie at the local and community level.
Thank you. Those challenges. And I know that when we go to the next panel, while we're doing grass tops, shall we say, of the networks of networks, we also have the community and ultimately the individual in mind here. And I just want to thank an excellent panel, not only of the challenges and opportunities, but also just the wisdom of where the world has been, where the world is going, and hopefully how we can work together amongst multiple sectors in this regard. So with that, I'm going to transition to the second panel, and we will have, thanks again, we'll have a quick question. And before we get to that, I'm going to mention, you know, what the next slide, please, Jen, of with the question. Oh, it's just a little tiny bit of lag. Here's the question: what are the greatest challenges facing employee communications related to vaccination? And as you may have learned in the last one, you can answer more than one. And while you mentioned the business partners to convince statement of shared purpose. So as I mentioned earlier, July of 2020, we had the meeting with this call to action at the UN High-Level Political Forum. And with that, we had a number of participants, and then the business groups began to get together to put a statement of shared purpose. And this is what's been agreed: that business is a trusted source of information, well suited to engage, inform, and educate workers, their families, and communities with a message that inspires confidence in vaccination and encourages acceptance and uptake as COVID-19 vaccines become available. Therefore, we pledge to hear concerns, listen to feedback, and develop vaccine literacy strategies based on science, facts, and emerging information to counter hesitation and vaccine opponents through communication and education initiatives at the global, national, and local levels. And whilst this was negotiated over a number of months, in September, the business partners to convince had launched with this. And as you can see, a number of logos of other groups who have joined in this effort as we advance those challenges that we've not only heard about, but clearly the whole idea of misinformation that was on the last survey that also came out. So let's go to the survey question, and then I'll introduce the three panelists. Jen, do we have the results?
Thank you all for submitting some feedback. The greatest challenge we're seeing is different employee needs and concerns, and that could mean within an organization, it can mean in different countries. Outstanding 67% of you have responded that this is the most critical need.
Okay, so thanks. So with 2/3 of that in mind, of our audience, we're going to go to the next panel, which has three esteemed leaders amongst employer networks. Roberto Suárez Santos is the Secretary General of the International Organization of Employers. IOE is the largest private sector network in the world with 159 business and employer organizations in over 150 countries. We're happy that Roberto will be speaking first, and will speak about a number of events that they've had and activities, including one recently at the highest level for the global environment. Karami-Ruiz is the Senior Director of Strategic Engagement and Communication and Business of the OECD. The OECD has a global network of 59 national business organizations, and they coordinate outreach to the OECD ambassadors and all the Paris-based delegation. He also is engaged as the organization's spokesperson for the OECD, as well as external stakeholders. And then thirdly, Andrew Wilson, who's the Global Policy Director of the ICC. The International Chamber has a permanent observer role, and he has that role as the United Nations Director of Global Policy and International Affairs. He oversees ICC's engagement with international organizations and processes, which includes the UN, the EU, the WTO, and the Group of 20, and has worked and continues to lead the ICC's policy recommendations, practical guidance, and standard-setting activities. I'm really pleased to introduce these three experts. I've been enlightened to be on panels, one yesterday with Andrew, with Roberto, it's Geneva one with Tedros and the ILO and others. We've had a lot of great work in beginning our business partners to convince. And over to you, Roberto, just to ask really a question for all three. What are you hearing from your networks and employers about what the challenge is and where they are right now in terms of the COVID pandemic response?
Well, thank you very much, Scott. Thank you for this invitation. Let me just start saying that we are proud to be part of the Convince initiative, and we are committed to promote it also using our network. At the end of the day, what we bring to the table is not just the number of companies, it's business organizations that have a big say at national level and that can change policies. So this last 1.5 years, let's say, we are experiencing not just huge challenges, but also huge transformation in the business environment and also in the business organizations world. And what we are witnessing is, of course, not just the efforts to adapt to the pandemic, to assure survival. I mean, it's quite striking to see in some areas of the world that 20% of small and medium companies are disappearing or are at the border of collapse, but also that the health and safety area is becoming at the top priority. And it's becoming at the top priority because, of course, of values, but also because it's also closely linked to the recovery. And we repeat this message yesterday. I don't know whether you are aware that yesterday we had the International Day of Occupational Health and Safety at Work. And precisely this message came through very clearly. Business survival and quick recovery is closely linked to the way we handle health and safety at the workplace. In these turbulent times also, and that's also another point that is becoming clearer, curiously, contrary to what we saw in the past, a trusted partner not just for the workers, but also for individuals, are companies and also companies' organizations. And I can quote the Edelman Trust Barometer of 2021 and the USA, reflecting that business have become the only trusted institution for a head of governments, NGOs, and media. But trust, and that's the challenge, means also more responsibility. That's clear. And there is a huge amount, not just of work, but also of challenges ahead of us. First of all, what we are witnessing, and that's your question, is uncertitude. Uncertainty and lack of coordination from governments at international but at national level. Many companies have been facing the need to put into place preventive measures, testing regimes, vaccination. But at the same time, they continue to have a deep impact in the way they make business and in the way workers relate to them. And I'm not just referring to remote work, but also other channels of communication, other ways of working. But also these same companies have to implement some testing and vaccination regimes that are not easy to handle from a legal perspective, but also from a human resources perspective. We have launched several initiatives together with WHO. We have participated in joint events, and also we have brought them with us, but also the International Labour Organization, precisely, and we have just provided some guidance to overcome this uncertainty. And we refer very much to vaccination, which is now at the hotspot because of precisely the need to start putting that into place. But we should not forget also that areas like social distance, hand hygiene, and mask will continue to play an important role in the future. And we have now the reality of viral variants that are emerging with concerning characteristics around the world, which make also exit strategies from lockdowns very difficult. We are also joining efforts with the workers, and I had a conversation precisely yesterday with Sharon Barrow, the International Trade Union leader, on the other challenge. I think it was Lawrence who referred to that. The pandemic is broadening inequalities, but what we used to call the digital divide is becoming now it could become the vaccination divide. Of 128 million vaccine doses administered so far, more than 3/4 of those vaccinations are just in 10 countries that account for 60% of the global GDP. So the international collaboration is clear that is not working, or it's not working at the path that it should be. And the COVAX system, which was referred to by Lawrence, is a critical tool. And we need to work together also to strengthen the capacity to mobilize funds to make it efficient. The WHO has repeatedly issued a call to all countries to work together in solidarity and in the best of the interests, but that's not still working. And precisely the convincing initiative can make also a difference if we act all together. So right now, if I can sum up to this question, is what we have is from an angle, I would say, a question, a huge challenge from companies, from employers' organizations related to the lack of certitude, different regulations over rapid regulation, lack of coordination, but on the other side, a kind of awareness that if we don't push the agenda of vaccination on an equal path, we will all be losers here. So that's precisely the main point of action that we are just trying to push from IOE. And I would also come back to other questions. Thank you again for your time.
Thank you so much, Roberto. Indeed, big challenges. Ali, over to you.
Thank you, Scott, and great to be with everybody. And then you mentioned who we are quite well. If you take the US Council for International Business and you multiply it by 60, that's our global network. And this is how we engage with OECD in all aspects of policymaking. So of course, one of the main questions that come very organically when we talk to our different members across the globe is they actually, the first thing is our network wants to compare and our network wants to connect with each other, because of course, the situation is very different. The rollout speed and the phases are also very different. So what comes across as, in every call is they want to understand, well, how are things going in Italy, and how are things going in Australia, and what can we learn if Australia is going at a quicker pace than we are? What can we learn so that whenever we get there, we can actually be prepared for some things that you've already lived? So that's one of the things that our network wants to understand. They want to know how others are living and breathing the rollout of vaccination. The second thing that they want to know is they are very keen to understand how they can easily incorporate and adapt information so that we can all collectively address any issues that might come up in the media that might actually increase hesitancy. And this sort of takes us back to the first question that you asked in the chat. And that is because, for example, when you had these isolated cases, for example, of the Johnson & Johnson vaccine, and then in a number of countries the vaccine was stopped, and then the same thing happened with AstraZeneca for 48 hours in Europe, and then it was resumed. What our employer network asked us was, well, now we had this media set of messages. What do we do now? How can we? Our respective networks are asking, is it safe, and can we do it, and do we recommend it? And so what, beyond the set of initial messages on the communication on the vaccine and why we need the vaccine, what they want to know is, what is the best way to provide up-to-date information to address some of these minor challenges that are sort of coming up on the road? And I think that this is one of the things that Convince could do pretty well in terms of adding value to our national members. I think the third element that our network wants to know is they want to understand what types of policy messages can work as our members relate to policymakers. I mean, this is something that also Heidi was mentioning just a few minutes ago. And clearly, for example, I'll give you the example in France, where the president of our national member federation was asked in the media, well, would you agree that employees should would you agree to giving the ability to employees to use the time during work to go and get the vaccine? And he said, yes, of course, it should not be a big deal. Not everybody would agree with this, but these are some of the messages that, at least in France, just to give you one example among many others, they worked really well because it showed confidence, it showed openness from employers, and it showed a way to encourage employees to go and actually get the vaccine as soon as it is available to them, according to different age groups, of course. Then another big theme that we have spotted as a pattern is, how do we leverage SMEs? Roberto was mentioning SMEs just a few seconds ago. What we have seen and what we've heard also from our members is, beyond the employee engagement efforts that we see for big companies, with SMEs, we do have an opportunity because on many occasions, these are the folks who are actually in contact with people on a daily basis beyond their, let's say, employee network. And these are the people who, if they have the right information, if you're looking at if you go to the flower shop, if you go to the grocery store, and if you're talking to these people, between the SME owner or the SME employee, these are, in many countries, some of the very few stores that were actually open in the middle of the different set of lockdowns and curfews and whatnot. And so what our employer network has realized is that if they have the right information, then they will be able to have a multiplier effect, which, if we don't work it out right, we could actually have the opposite effect of misinformation being spread, and then more people are actually saying, no, I don't want to get the vaccine because I heard so and so such and such thing in the media. So and then one last thing that our employer network would like to know is, if we could identify some positive examples that communicate the benefits of the vaccine post getting the job. And actually, what you see is that there's a lot of material when it comes to this is why you should go and get the vaccine. A lot of it, I think, has been pretty well covered, but we haven't maybe fully leveraged the overwhelming positive experience of, most people not having side effects, most people actually gaining when it comes to, of course, productivity even at the workplace, because then, they're even, that facilitates a return to the office. And I think that could be an untold success story that we could perhaps focus on. So I'll stop there, and we'll continue the conversation in just a couple of minutes.
Great, Ali, and thank you for picking up on both the SMEs of Roberto and the information challenges that Heidi and others have raised. And Andrew, I'm going to go over to you. It does not look like you're in New York, but
unfortunately not. No. I was repatriated to France just as vaccines were starting to be rolled out in high numbers in New York. Would you believe?
Okay, well, great. Well, thank you for being here today, and I know you've done quite a bit in this space. And what are you hearing from your networks at this point, and actions that are ongoing?
So I'll pick up on 5 themes that I think are broadly relevant to the Convince initiative or the Convince campaign. The first is, and I think it's really important to emphasize this, when we speak to our network, particularly in emerging markets, but certainly not limited to, access to vaccines is ultimately the key issue of concern. And I just want to emphasize that there is, I think, deep frustration within many parts of our network in Latin America, Africa, and Asia in particular, about the pace of rollout of the vaccines and the significant inequity that we're seeing. And I think Roberto said earlier, we're at risk of seeing a vaccine divide similar to the digital divide. Well, I think we have it already. It's very, very clear if you look at the rollout numbers. And I think clearly that is a great source of concern and frustration to many businesses and chambers of commerce in our network. Second thing, which I think is interesting, is increasing when we talk to chambers in our network, there's a growing interest in the mRNA vaccines. And that to us suggests growing hesitancy in relation to the AZ and perhaps also the J&J vaccines, fueled by recent press reports from Europe and the US, I suppose. Third thing on a more positive note, though, is clearly there's an eagerness to act, both on the part of businesses, large and small, and also our global chambers network. And often when people contact us asking questions about what can be done to speed the rollout of vaccines, it's not a passive question. They actually want to know what business can do in terms of providing in-kind support, financial contributions, whatever it may be, to assist the rollout. So clearly, business wants to be active. And I think one of the challenges that we have is getting governments and some of the international organizations in this space to harness that appetite to be actively involved going forward. Fourth thing, I'll be very quick on the final 2 points. What is really interesting is I think business, certainly many of the businesses we speak to, instinctively understand that ending the pandemic requires globally coordinated action, which to our mind stands in stark contrast to what we've seen from most, if not all, national governments in terms of taking a my country first approach. And I think that the division in the outlook is quite stark there. And then fifth and final point, which I think is possibly the most relevant to the Convince campaign, is we've seen a really significant demand from our network, both from corporates and chambers of commerce, for reliable, verified, trusted information they can use to take responsible action, whether it's in terms of making workplaces safer, whether it's in terms of configuring working from home arrangements, you name it, we've been asked for it. And I think it shows that businesses are operating, as Roberto said earlier, in a very, very uncertain environment, and one in which they need to be able to access reliable, trusted, verified information that they can base decisions off and also communicate to their teams.
Well, thank you. I mean, I think these are all great challenges, and it's unfortunate to hear the deep frustration, but yet I think it is a theme that we've been hearing in a number of events of the need for global coordination. and engagement amongst multi-sectors. So I'm going to take the prerogative of adding in the question in the chat of if business is also engaging with trade unions and what their role is in terms of raising awareness. And then also ask a second question to each of you. We'll only have one really question to wrap up. So where we go from here in terms of engagement with your networks, other networks, and our hopeful way of advancing with both business partners to convince and other activities. If I could go back to you, Roberto, first, please.
Okay, in terms of our action, joint action with trade unions, I think that this is an area of convergence. I mean, because this uncertainty affects very much the workers, and it's tricky also how, first of all, first area of action, and I want to identify that, how to come, and I don't like to use the word back to work. It's very tricky to say back to work or back to normality. I still have not found any wording for that, but how to come back to the facilities. And that's really an area of action. We need certitude. It's difficult, but we need to work further on this certitude from a global and national perspective. And for this, we don't need to compete each other. We need to act jointly. That's the first area of action. The second area of action is, I mean, and there's no hierarchical order, but if I have to select one or to choose one as priority, is equal access. And equal access, I want to insist, is not just an issue of justice, ethical, which is important, it's an issue of effectiveness. If what's going on now in India is not rechanneled, it will affect all of us. So we are not really convinced, and may use the word of this, of the initiative itself. We're not really convinced on the need to push hard on equal access with the COVAX system, mobilizing funds. I think that Andrew was referring to that, and also our own responsibility as business. Okay, we will have counter effects in the very short term. And the third area of action, and some of you also refer to that, and it's becoming now. We have the green. I don't know if it's the green passport or the green pass. Or, that has also to accelerate. Mobility is totally linked to recovery. So if we do not have a kind of system that is coming, I think that, and I hope that it's coming, to recognize the different testing and the different also vaccination, not just vaccination, but also the testing system, we are not going to do good in terms of quick recovery. So for me, those are the three areas of action where I would like to move the agenda. Thank you, Scott, for your time.
Thank you. Very, very clear, and I appreciate that. Ollie?
Thank you, Scott. And just picking up on what Andrew mentioned on the frustration, there's a policy challenge tied to a communications challenge, which is in most, at least OECD countries, the role started with the elderly, and then it's going progressively down and down until we reach youth, right? So we reach young people. And this is a real challenge because what we see is, and our network confirms it, is there is still a lot of reticence, a lot of hesitancy when it comes to getting the vaccine. And the reason for that is young people say, well, if we've already taken care of those who are vulnerable by getting them inoculated, then that's it. If I get it, it's okay. It'll just be a bad thing for a couple of days and then it'll be it. And I think that's where the real challenge is, because if we don't get young people to actually get the vaccine, then we will not reach the levels that we want. We will not reach herd immunity. We will be more vulnerable to new variants. And you know the story very well. So that is the real message there. And then this is something that Scott, very well. My perennial question is, who will then be the messenger? And somebody mentioned the Edelman barometer a couple of minutes ago, and I think that's a good question. How do we engage with governments? How do we engage with trade unions? How do we engage with any other relevant stakeholders to make sure that we are preparing those messages now whenever vaccination will be available, at least in Europe, to young people? And then again, for those countries where the vaccine is already available for young people, what are the lessons learned? Are we seeing numbers going up, or are young people not getting the vaccine? And then just basically comparing those notes and then seeing where do we go from there. And even there, I think there could be a couple of takeaways for the OECD when it comes to international collaboration. And so then, of course, in terms of, where do we go from here, what we will do is we will convene a meeting where we will bring, because up until now, these conversations that I've had with the network, they've been held bilaterally. What we will do together with you, Scott, and others is we'll get them all together so that they can share these perspectives. Actually, one of the other challenges that our network has identified is how do we get healthcare professionals to also get the vaccine? Because we know that so let's say in some countries, this is a group that still has not gotten the vaccine at the levels where some stakeholders would want to. So these would be some of the issues that we would discuss so that we can also identify how Convince can add value there.
Okay, Ali and Roberto, you're on message in time. Excellent. Andrew, over to you.
Thank you, Scott. I'll be very, very quick. So I think there are three ultimate things that, from our perspective, and the first is a need most definitively for an effective, and I really emphasize that word, effective global effort to end the pandemic, including the rollout of vaccines. We've made very clear a few months ago the economic risks that countries are running in hoarding vaccines or in prioritizing their own citizens above those of other nations. And ultimately, at some point, we need international economics and economic reason to trump domestic politics. Otherwise, I think we risk a severe global recession and a very, very lengthy, perhaps never-ending pandemic. Second thing on the effective point is we need international politics and some of the politicking we're seeing in global forums such as the WTO to simmer down a little bit and really focus on real world needs. And this is the key point around effectiveness. We see debates, I think one was mentioned earlier, around intellectual property and tech transfer, when actually the real debate should be on how do you scale manufacturing? How do you get more investment in production networks, and particularly to secure the supply chain, which is, as you know, under a great deal of stress currently. And I think unless we rebalance that debate, so unless we actually see a focus on the economic or business case, unless we see a focus on the real world need, I really do fear for the outlook for the rest of the year, both in human and economic terms, I'm afraid to say. The other thing on a more positive note is I think there is a great deal of latent capacity to more effectively engage the business community as advocates, as I think Ali mentioned earlier, but also in practical ways, providing in-kind solutions to assist efforts to bring the virus under control. And the final thing, and I'll leave it there then, is very clearly we need a more holistic approach to pandemic controlment. There is almost in some countries, and we see this I think throughout our network, almost singular focus now on vaccines. The question is that correct in a world where supply is expected to not meet demand for many months and perhaps years to come? So we would like to see governments, influenced by business, one would hope, adopting genuinely holistic approaches to pandemic containment, focusing on scaling of testing, availability of therapeutics and treatments, and also applying other practical tools, such as a tool we launched several months ago in pilot phase, AOK Pass, that really tries to enable cross-border mobility in a safe and controlled way. We think there's a lot more scale to do that if governments can step back from the focus on vaccines and think about pandemic containment in a broader context. I'll leave it there, Scott. Thanks. Hope that was helpful.
Oh, no, thank you, Andrew. That was terrific. And as all of you who are listening can see that Andrew, Ali, and Roberto are indeed great diplomats. And what they do is practice what I call sort of corporate diplomacy, but even more, global health diplomacy in this regard. And, we have seen things float around on vaccine diplomacy and nationalism. That's not just what we're getting into by any means. And as Andrew mentioned, we're looking not only at vaccines as a primary, but in the business partners to convince a workplace challenge you'll see that we talk about and other novel countermeasures. So the hopeful nature of technology advancement and the other novel countermeasures that, as we know, can even include masking and social distancing, which Heidi referred to as medieval in the initial phase, but there are ways that we could continue to advance that also in the workplace. Let me also mention that Ali brought up healthcare professionals as being important, and that is a work stream in Convince. Nancy Lee had convened with the Sabin Institute and Ariandi and others, the World Medical Association, that have engaged with us on that work stream. And maybe there is a way also to bring the healthcare professional work stream and the advocacy nature of getting them both vaccinated. That was also the challenge that we heard from our GAVI keynote, to also engage all the way through to youth and others. So there's many, many challenges. You've heard of the other couple of pieces of Roberto mentioning a green pass, which is what Israel had called theirs, which is a pass that if you are tested negative or have been vaccinated, you can return to workplace or wherever the right term will be. Also access to events. There's been different discussion with an AOK pass, ICC and Excelsior pass in state of New York. There's all sorts of different pieces. That's another discussion that maybe we will have in the future. And just as we've also, Larry Gostin mentioned his piece that he did in the Journal of the American Medical Association, at least on mandates for the US population and what could be done. So with that, I'm going to close this panel unless any of the panelists have any burning platform questions for each other or something else to add. And then we're going to move to the next panel and one other question. And we really appreciate Roberto with the IOE and Andrew and Ali, who I know will continue to be engaged in a meaningful way with Convince and business partners to Convince. So here's the question that goes in before our final panel. How can the private sector support vaccination confidence? 1, listening and communicating with employees. 2, providing incentives to get vaccinated. 3, advocating for workplace policies to support health and well-being. And 4, engaging and supporting local community efforts. And those of you have learned by now that you can say anywhere from 1 to 4 of these. While we're garnering those, I will transition if we go to the next slide for the next panel. I'm really happy to be able to introduce 3 of our experts on the private sector panel. Let me just say at the outset, we're very pleased that all 3 of these companies are also on the Business Industry Advisory Council, our Business Advisory Council for Business Partners to Convince. They've been most active and supportive, and we're pleased to have the experts. So I'll read the bios, and then we'll have the answer to the polling question. So we're pleased that Dr. Julia Spencer, who's the Associate Vice President for Global Vaccines, Public Policy and Partnerships at MSD, has joined. She leads the global public policy and advocacy efforts to expand access to the MSD vaccines, and she also develops and guides policy strategy and tactical implementation to achieve population health impact. She has 25 years of public health and health policy experience. Before joining MSD, she was a senior health official in the U.S. Department of Health and Human Services. Thanks for joining, Julia. Meredith Flynn-Ripley is the Senior Vice President, General Manager of the Vaccine Cloud at Salesforce. She's responsible for the vision, strategy, and management of the Vaccine Cloud, which is the latest project initiative from Salesforce, which is developed to handle all aspects of vaccine management to meet the public sector, healthcare provider, and commercial organization needs. Currently, Salesforce Vaccine Cloud has over 150 customers and enabled over 50 million vaccines and counting upwards. And then finally, Dr. Vicky Weldon, she's the Global Medical Director of ExxonMobil, also with degrees in public health. She's the Global Medical Director where she develops, delivers, and manages the company's occupational health services. She's also been implementing ExxonMobil's Culture of Health initiative. And before she had her global role, she managed occupational health services with divisions of ExxonMobil in the US, Europe, South America, and Asia. We're pleased that all 3 of them will join and speak about what their organization has been doing and some future thinking ideas. And these are our poll results. Jen, I'd like to.
Absolutely. So if we look at the results, 82% of you have said listening and communicating with employees is most critical. Certainly, there are multiple choice here. And second is advocating for workplace policies. But there are still quite a few of you, at least half of respondents, saying that incentives as well as local community efforts are important. So certainly we have multiple issues to juggle as a private sector community.
Great, thank you, Jen. As we have these leading questions that we know the private sector will need to engage, and as we've heard from all of our speakers on other panels, the hope that we can be engaged not only in a leadership role, but also helping engage in the global effort. So with that, I'll turn it over to Julia, and we'll go through with this panel as we have the others. We're right on time, so over to you, Julia.
Great. Thank you, Scott. And it's really a pleasure to be joining my fellow panel members to discuss this important topic and to share some of our experiences in the work that we've been doing within our company. But I also just wanted to thank all of the other panelists and the people on the phone and everyone in all of our organizations who are interested in this issue. I've been working on issues around vaccine hesitancy since back in the 90s when I worked for HHS, and it's just so heartening to see the multi-sectoral response to this issue, not just in COVID, but certainly that has been even more reinforced in COVID. So I think one of the things that I hope personally is that all of the momentum and positive work that has been started will not end with COVID. And so just wanted to thank everybody for their engagement on this. Merck is a global biopharmaceutical company. We're also known, as you mentioned at the beginning of the conversation, as MSD outside of the US and Canada. We employ over 74,000 people worldwide. And we are really proud to be part of an industry that has brought forward multiple COVID-19 vaccines to help in this pandemic, and of the role that we are playing as a company in developing COVID-19 therapeutics and manufacturing COVID-19 vaccines. However, vaccines only work when people get vaccinated. We have been developing and manufacturing vaccines for more than a century, and a number of our employees are global experts on vaccines. But not all 74,000 of us are experts, and indeed most are not. The majority of our colleagues do not work on vaccines issues and are like anyone else who wants information to make informed decisions about vaccination. Since the first days of the pandemic, protecting the health and safety of our colleagues has been a top priority for the company. And over the last year, we have been committed to communicating regularly, clearly, and consistently with our colleagues all around the world. Initially, we were focused on information about the virus, about how to stay healthy and how to stay safe. And today we are focused on educating them about COVID-19 vaccination and providing answers to questions they may have about COVID-19 vaccines and vaccination more generally. We found that it's important to listen, to approach conversations with compassion, and to equip our colleagues with resources that can help them make informed decisions about vaccination, both for themselves as well as their families, like you've heard from the other speakers this morning. We've also been working to better understand the needs of our employee population so that we can meet them where they are. And I think you heard that resonate in the poll questions as well. And so from mid-February to mid-March of this year, we conducted a survey of more than 1,000 of our US-based employees, really on awareness, attitudes, and behaviors related to vaccination, including COVID-19 vaccines and routinely recommended vaccines. And in generally, the findings suggest that most of our US-based colleagues understand how vaccines work and have a high willingness to receive vaccines. However, we know that hesitancy is complex and questions and concerns remain. And even if you agree to get vaccinated, it doesn't mean that you have full confidence in vaccines or in the system that's responsible for vaccination. There may be other factors that are influencing your decision, and that really bore out in our survey results. For instance, 94% of our colleagues surveyed indicated that they are very willing, so 8 out of 10, or somewhat willing, 1 out of 10, to get COVID-19 vaccines. Yet 4 out of 10 indicated they worry about potential side effects, and about 1 in 4, or 25%, were concerned about safety. In addition, we found higher expressions of concern among women and among Black colleagues. And as we celebrate World Immunization this week, we're looking at new ways that we can try to get additional information out to our employees. And so we have developed an educational program that we're rolling out this week to help address questions that may be top of mind for our colleagues about COVID-19 and other vaccines. And we are also more broadly encouraging our employees to prioritize their health during this time and the health of their families and the health of their communities by speaking to their healthcare providers about COVID-19 vaccines and any other recommended vaccines that they have missed over the last year, and also to ensure that they're continuing to follow community public health measures so that we're all working toward getting out of this pandemic together.
Oh, thank you, Julia. Great to also hear the survey of the 1,000 Merck employees and to share what your contribution during World Immunization Week with this education module. We'd certainly like to be able to highlight that on Convince and other activities. So thank you. We'll come back to a second question. If we could next go over to Meredith on your perspectives, please.
Sure. Thank you, Scott. Thank you for having me. Really find this forum so helpful and enlightening, and really providing a broad perspective, which I think, and this dialogue is so critical to what we all need right now around the world. So Salesforce, if you're not familiar, is a top technology company. We're in the business of providing software platform that enables customers to service their customers, market to their customers, provide sales, technology, commerce. And so, we responded in 3 different ways. One, from our own employee standpoint, the company, we have over 50,000 employees located around the world. And we were built on core values of trust and innovation and equality. And so we responded immediately to our employees by really putting a playbook in place and understanding and developing a phased approach on how we are going to help educate our employees on this COVID-19 pandemic. Because of who we are, we also responded to our customers by configuring our platform and really delivering free products and services. The first initiative was called Salesforce Care, and this was to help our customers communicate with their constituents. So hospital systems around the world, public health departments, local governments and federal governments, how do we help educate the population and the customer base on how to respond? We then, and this was all launched in a matter of 3 weeks. We then responded by working with our own employee success teams and security and real estate teams to develop the work.com solution, which resulted in contact tracing capabilities. Many people in product at Salesforce had never even heard of contact tracing, yet we configured our platform and delivered the solution to over 85 local, state, and national governments. And we currently protect over 660 million people with contact tracing technologies, daily health attestation surveys, and also the concept of how do you return to safe in-person experiences. And so that technology platform has subsequently evolved to Vaccine Cloud, which we launched, and as you said, is supporting over 150 global, national, state, local governments, public health departments, and some commercial organizations in the private sector to enable every aspect of vaccine delivery. It's really been an amazing collaboration with our customers, with the local community, with state and local governments. I would say the last piece of this is our community response, where we've pledged over $4 million, including to the Convince organization, around the equitable distribution of vaccines, because equity and transparency and trust is such a core value to Salesforce. It's been very important for us to get as involved in the local community, which, as we heard earlier in this webinar, is so critical. So we are providing mobile pop-up technology platforms to bring vaccinations out into the community, to the elderly in the UK in their homes and deliver the vaccinations in their homes, to go into more rural areas where the vaccinations are not available in the US right now. And we are looking obviously globally across all of our all of our countries and around the world in terms of how we can help enable vaccine management and communicate. I think these poll results are fascinating because it ultimately is a communication challenge. And how do you get that trusted, verified information out to your different constituents? To our employees in Japan, there's a different message that needs to be said versus Brazil, versus Amsterdam, or New York City. So it's an ongoing challenge that we are actively working to help educate our customers, our employees, their families, and globally.
Well, thank you, Meredith. And what just a perfect segue, shall we say, to Vicky, of the 50,000 employees that you have and the millions of people you've been reaching with work.com and the cloud, and the 74,000. We heard a little snapshot from Julia on the Merck employees. Now, Vicky, I know you have a big, well, I'll drum roll of the responsibility and role that you have, and really looking forward to hearing your remarks from ExxonMobil.
Thank you. And I do want to say this has been really interesting, and I'm kind of glad that my live screen wasn't going, because I've been shaking my head, yes, like throughout this entire webinar. I'm really happy to hear so many people working on this really important issue, which affects everybody, not just our workers, not just your workers, they affect everybody. And some words that have really like struck me: holistic is really important, equitable, and trust. And then communicate. I mean, that for me sort of sums up the biggest areas where we really need to focus. And I'll just say that I'll kind of talk a little about our response initially, and then I'll talk about the role vaccine is playing and what we are doing as a corporation, and as what I'm helping to do as a medical director for a large global company. We have always, for many years, prepared for a potential pandemic. We have had periods where we have had outbreaks that have been extraordinarily significant, including Ebola and MERS and SARS. This event has been extraordinary in its scale, its scope, its pace, and the duration. So while we had many tools already prepared, we had to make many changes on the fly. And most importantly, we really had to understand this new disease. And I think one of the most fascinating aspects of this is that we are seeing science in the making, and trying to explain and help people understand we have never seen anything like the massive amounts of information, partial information, credible information, misinformation, and an entire mix together coming at us, coming at our workforce 24/7. And one of the most important things that we had to do was to really filter through and determine what we thought was the important information, what was reliable information, and really become a trusted source for our workers. And when we communicated with our workers, either about protocols we were going to put in place, what we thought was happening and why we thought it was happening, all the way up to vaccine, it was very important that they understood that we were evaluating the science, and we were looking at the power of information, so that when we spoke to them, we were allowing, particularly with vaccine, we've framed it as we want them to make informed decisions, and we want to help them by arming them with information that we believe is trustworthy. And then we've asked them to share it with their family and share it in their communities, because we think that is an important aspect, that nothing that is happening is just limited to a fence line. We're part of the community, and the community is a part of us. So it's very important that we approach it from that way. But information and communication, as many have alluded to on this call, have been one of the most critical aspects. And we've used multiple modalities. We've used podcasts, webinars, written communication, We've developed over 150 guidance documents for procedures and protocols at our various locations, and we're operating in around the world. So at any one time, a location is in a different place than another location in terms of what they're experiencing for the prevalence, what the local public health authorities are telling our workers and what they're hearing in those. So I would say it has been the most challenging part, is just trying to develop, to set a standard that we thought was based in science, and then help people where they are to kind of rectify that with what they hear in the news or even through local authorities. So it's been a massive effort. And I'm really pleased to say that it's introduced some amazing collaborations, not only for groups like this, but even within our own company. We have had engineers helping us to think through things. We've had data scientists join our team. Of course, we have industrial hygienists, nurses, and doctors, but then we have, all of these very different perspectives coming together to say, we've got this problem. How are we going to do this? And how are we going to address it in our workplace? As many companies have had the ability to work from home and with minimal disruption. But for us, we have a whole variety of settings, including operations and manufacturing sites that are really critical to infrastructure, even to the response for COVID, providing supplies, helping with supply chain that we couldn't have disrupted. So we had to develop ways for people to safely work. So I'll kind of close with, one of the things we did is we really leveraged what our company is good at, and that is we are very safety minded, and we're very much use risk management as a way to manage our work. And so we applied those principles. Even when we think about vaccination and vaccine, we're applying risk management principles. There's the risk of getting the vaccine, and maybe there's a few unknowns. But once people understand what has been done to ensure the safety versus what the risk is of getting COVID, and you compare those two risks, it becomes, maybe there's a little bit of risk you accept when you get vaccinated, but it's nowhere near the risk you accept by not getting vaccinated. So trying to help people see things in the balance of risk has been very important to us. And we think that it really helps frame it, because there's a real bias right now towards, any type of risk. And you have to kind of help people through that uncomfortable feeling, as there's a lot of focus on it, and kind of balance that with reality and the risk that we all accept every day. There's much more that I could say, but I want to turn it back because I want to hear everybody else as well.
No, thanks, Vicky. It's really been impressive of the type of work and the understanding of the risk equation and how that gets communicated. And both you and Meredith both brought up communication is key. So I'm going to flip this back to Meredith now. What are you hearing of where the communication is needed, and also what level in the organization? We heard what ExxonMobil is doing with the 150 guidance docs and so forth. I don't know at what level, where they come from the CEO all the way to the line manager, just the medical departments. But what are you hearing with Salesforce, since you've got the 150 plus with your vaccine cloud, as well as work.com?
Sure. So you can't over communicate. At Salesforce, we actually send a daily newsletter to our employees every night. It comes out. It's talking about maybe some of the latest data, some of the news opening when we opened our Australian office, for example, or Singapore, just really sharing the journey because we're all learning along the way. How do you really respond in the right way? We do a weekly all hands webinar across the company with all of our executives, CEO, CTO, really talking about some of the policies and then talking about the business. And we do a quarterly survey around our employees mental health and wellness. You know, this isn't from a productivity standpoint, because Salesforce is a cloud-based technology. The transition to move to a work from home and success from anywhere was actually pretty seamless. But the mental health and wellness certainly took a hit amongst our employee population. And so again, we've actually developed some products to use, you know, within ourselves, but also for our customers, because we hear this pretty consistently. You know, to follow on what Vicky was saying, I think one of the biggest challenges right now for private sector is how do you balance that operational risk? Our medical advisors, Dr. David Agus and Dr. Larry Brilliant, will tell you that it's critical that every company understand the health status of their employees. Now, health status from a testing perspective and or a COVID vaccination perspective. How do you balance that with your employees' privacy? And we're working right now to basically develop policies to make sure we're not mandating vaccination, but we want to make sure when people are returning back to in-person experiences that you're not creating a two-class system within your company. That said, Salesforce is the only company so far that has actually announced that we do have a vaccination requirement for a vaccination cohort that is coming back into a San Francisco headquarters in May. And that's a pilot, and we're going to see how it works. I would say the other thing in terms of understanding your health status, testing is going to be critical. That's a challenge to put that daily testing in place. We're going to test twice a week. We'll have thermometer stations on the floors. And so how do you get that data? You know, we've pre-built flows so that companies can basically ask their employees to upload their vaccination card, storing as minimal data as possible. Again, everything is privacy protecting for the individual employee or the holder in the trust triangle as we talk about it. So, you know, I think there are a lot of challenges. I would end on, I think, an interesting challenge that I'm wondering if other people are hearing, which is in the US and in some countries like Australia, where you basically have very, very low, if not no rates, there's a belief that this will be over in 6 months. And we hear this from some of our customers as well. You know, this is going to be over in 6 months, and then we're going to all go back to the way things were. And so I think it's a higher level communication that these organizations in this webinar today, you know, really have a mandate to help people understand that this is a marathon, not a sprint, and that the operating, I know Roberto was kind of, you know, what is it, the new normal, but how we operate businesses, you know, has to take into consideration promoting vaccinations. Booster shots are a reality that we have to plan for. And private sector just can't think that public sector is going to take it all on themselves and it's going to go away.
So Meredith, thank you, and well said. It's a marathon, not a sprint yet. Maybe business would like a quarterly or a target that they could get their people vaccinated by the end of the year. Thank you for sharing what you're doing at Salesforce. I mean, it'd be great when you're willing to share the success of the pilot of getting people. I like how you said it, not just you know, back to work or work from home, but success from anywhere. And you know, the mental health is key, and we've only been able to touch on that briefly. So I'm going to go back to you, Julia. As you mentioned, last century, in the 1990s, you worked at the U.S. government. You began looking at vaccine hesitancy. You saw that in measles, mumps, rubella, childhood vaccination, and others. And then you fast forward to where you are with COVID now. Given what you've seen also now with your Merck survey and other pieces, where do you think that the challenges and the place that companies can make the most difference in the space?
Yeah, thanks, Scott. And you know, in some ways the issues are the same. In some ways they look different. But as you heard from Vicky and from Meredith, and I think, like, you know, most of the employers that are on the call today, our employees have had differing experiences with the pandemic, depending on where they are. And you know, we had our offices in places like China people started coming back in, you know, in limited ways back last summer. And then you have those of us in the US who are continuing to work at home if we can. And then when, you know, and so then when we think about the health and safety concerns and the, you know, the questions about getting vaccinated, those also look very different depending on the circumstances of the employee. For people who are working in our labs and in our manufacturing facilities, they have been continuing to work as needed in our facilities through the entire pandemic. And, much like, Vicky was saying, we are a company that has a very, very strong safety, culture. And so ensuring that we were stepping up the safety measures so that the company could continue to do the essential work that it needed to do, which is continuing to conduct research and development for COVID products, as well as other medicines and vaccines to meet unmet medical needs, as well as to continue producing, shipping, and delivering our medicines and vaccines that already exist. And this was a real challenge, especially at the beginning when some global supply chains were very, very impacted, and the ability just to be able to continue to get vaccines to the people that need them around the world was a day-to-day challenge. But when we think about vaccination, I think we also appreciate that the life experiences of our employees are also very different, and the cultural context in which they are working and that they are from are very different. And so, I think as you've heard from other speakers on this panel today, meeting people where they are and understanding that the messages and the information that you provide, while consistent, need to be tailored to the place that the employee is, whether that's geographical or whether that is because they are part of a group that has experienced marginalization or other issues that bring them to the question of getting vaccinated at a different place than at others. And so as we think about communication, agree, over communication is not, I think, a thing in this situation, but how do we both be consistent in an evolving environment where the science is changing rapidly and do it in a way that is tailored to meeting people where they are so that it is resonating with them, not just because it's the right message, but because it's the right messenger. And internally, we've been very, very fortunate that we have an executive committee member who is leading our policy and communications and patient engagement work, who used to be a US CDC director and has lived through a number of these kinds of situations, really guiding the organization from a public health perspective. And so as we roll this out, we understand that we have to do different things in different places, but it all has to come together under a coherent messaging environment.
Well, thank you, Julia. And I'm going to give the last question to Vicky after hearing all of this from the whole day, but even more particularly the panel and your vantage point. How are the efforts that you think we could best work together and advance the interrelationship of business and society?
Yeah, I think absolutely. It is listening to all these different perspectives and to really try to develop mechanisms of communication that can go down to even the field and the site level. And I do think where we can, and we certainly try to do this, is to partner at the local level with public health authorities, with the government, really to advocate for this particularly vaccine equity. Right now, the vaccine is not commercially available, so we really are relying on what the governments do in each country where we operate. So I think we all stand to benefit, as many of you have already pointed out, from as many people as possible being vaccinated. So I think it really kind of gets down to what can we do at each local level. Start at the country level and then go down to get people a vaccine. And I think it's important that we understand there now are many vaccines out there, and so again, before we can communicate, we have to understand and be comfortable that they are safe. And so I think this hasn't really been touched on, but there, for some vaccines, we know a lot of information. We can see it directly and decide for ourselves that, yeah, it's safe. And I can talk with a lot of authority about that. There's other vaccines where there's not as much information known. We made the decision to rely on the World Health Organization and their stringent regulatory authority clearances as an indicator that a vaccine could be considered safe. But I think For me, it's about just helping people through their fear, and maybe a variety of different ways of messaging and framing the answers to the questions that I think are very valid questions that people have.
Yep. Well, I mean, that's just a great, shall we say, close to all of this. I mean, Vicky, you've done a great job of bringing together what I think we've all been talking about. We're thinking global strategically, but acting locally and down to the individual level, and with and the uphill battle they all face. So I want to thank both Vicky, Meredith, and Julia for a great panel, and bringing all the opportunities that business can step up. So we're getting close to a close. I think we're going to run this quickly, if it will still work, and then we'll go right to Peter Robinson. So I don't have any sound, but if you just, we'll keep this running, if that's okay. So thank you. And in the final minute, to try to wrap all of this up, this was the COVID-19 Workplace Challenge brought to life with a little bit of music and the quotes from Peter. Let me just introduce again Peter Robinson, who's the president of the U.S. Council for International Business and USCIB Foundation. This group, USCIB, is founded in 1945 as a policy advocacy and trade service organization dedicated to promoting open markets and representing American business interests internationally. You've heard about the leadership with the shared statement of purpose and all the other activities that USCIB has done. I've been honored to be part helping develop business partners to convince and business partners for sustainable development. So over to you, Peter, to help closing remarks for today's session.
Well, thanks so much, Scott. This has been a really fantastic session. USCIB's Chairman Terry McGraw joins me in thanking the speakers for your inspiring and practical insights into the many critical challenges we're facing around the world today, and also in building vaccine literacy and confidence in the workplace and promoting vaccination. And I'd also like to thank you, Scott, for your usual masterful management and of this event and leadership in this initiative. And I want to thank all participants for your commitment and passion in addressing the complex issue in the workplace, for seeing the way forward to individual and societal well-being, and for getting back to business while sustaining the global economy. And with participants in this session today, really from all four corners of the globe, it's pretty clear to me that we're part of a growing global trust building and vaccines confidence movement. And I'd really like to make sure that we leave today with the commitment to stay connected and build momentum in this movement. At a very practical, actionable level, we can all share each other's messages, ideas, and events in order to amplify communications and messaging that will build on and resonate our narratives in promoting vaccines, confidence, and vaccination in the workplace. That's really the way that we as a group can counter misinformation and anti-vaccination sentiment. So in summary, we have three things that business partners to get convinced would like to ask of you in the coming days and weeks. First, join the Workplace Challenge that you just got a taste of. Please go to the BP2C website and sign up. Many of your organizations will already be doing or thinking about doing what the challenge is all about. And you can help enhance the powerful communications content, and your support will contribute to building global solidarity, generating the trust that is needed to build confidence in vaccines and vaccination. And secondly, for exactly the same reasons, and in the course of everyday workplace activities, request that other companies take the challenge. The more of us in this together, the more powerful we can be. And for our global business partners, and we really appreciate your participation in our meeting today, please get the word out to your global networks that there's an important resource their members can draw on at the right time in communicating with their employees. And thirdly, again, let's stay connected. Let's work together to leverage our respective channels and networks. Let's promote each other's initiatives so that we can all be more successful in achieving our employee, corporate, or network vaccines, confidence building, and vaccination objectives. And let's recall Dr. Gupta's words at the very start of this meeting when she reflected on the power of partnerships and solidarity. So again, thank you all for your wonderful participation today. We look forward to your support of Business Partners to Convince, and very much look forward to hearing of and seeing the growth of our combined initiatives into the future. So with that, take care and stay healthy.
Thanks very much.
Thank you. Thanks, everyone.